You have to think about infection before you start to treat it. In other words, it starts with the evaluation of the injury and how bad is the soft tissues. If the soft tissues are very contused and bruised, you may not want to put an incision through it right off the bat because you have a pretty good idea that that wound may break down and be a nidus for infection right off the bat. So I think the best cure is to try to do as much preventative maintenance as you can prior to going to the operating room. So judicious evaluation of the injury and the soft tissues and the timing of surgery is very crucial. Sometimes you don't have an option, it's open, so you have to go for it. Planning of the incisions appropriately or planning the fixation appropriately so that you don't devitalize a lot of soft tissue. The exposure is very crucial, being judicious, operating right where you need to be and not doing a grenadoplasty approach where you rip everything wide open. That's bad, it's usually bad. Appropriate prepping of the patient in terms of prep the skin, prophylactic antibiotics given ahead of time, appropriate surgical technique, not using a lot of crushing instruments or tearing of the soft tissues, being very soft tissue friendly. And then closure is very important, making sure you have a watertight closure. If there's a lot of edema in the wound, sometimes using a negative pressure dressing to help pull out the excess fluid because edematous tissue doesn't heal very well, again getting back to the blood supply issue. So sometimes using a negative pressure dressing is helpful. Compressive dressings, post-operative IV antibiotics for the usual amount of time. And then nutrition and careful wound management and follow-up. Once an infection has occurred, then you're on the track, then you're a whole different pathway of treating it rather than preventing it. So we try to do a lot of things in the OR, ahead of the OR, to really try to avoid that dreaded complication.